California policy, on ultra-processed foods. Hello and welcome everyone. My name is Isabel Madzorera. I'm an assistant professor at the Berkeley School of Public Health and a co-faculty director for the Berkeley Food Institute. BFI is a policy, research, and education institute housed at UC Berkeley. We leverage UC resources in partnership with communities to shape a just farm and food system. Today's webinar is the second of BFI's 4 webinar series, where we connect policy and research to explore key issues shaping our food and farming systems. To give you a quick preview of what's coming up in our 4 webinars, our November webinar will cover the 2025 evaluation update for the California Farm to School grant program. In our December webinar, we'll explore climate solutions in agriculture. You can register for these webinars on the BFI website under the events page. And now for today's webinar on shaping California policy on ultra-processed foods, I will start by providing a very quick update. A quick overview of ultra-processed foods. One second while I share the slides for that presentation. Great. So just to kick us off, I will provide a very brief summary of ultra-processed foods and what we know so far. So we know that ultra-processed food consumption has been increasing rapidly in the United States based on the NHANES survey, which was conducted from 2021 to 2023. We see that ultra-processed food consumption contributes to about 62% of the calories for children between the ages of 1 and 18, and for 53% of the calories for the adult population. So really showing a huge contribution to caloric consumption in the United States. Ultra-processed foods and the challenges around them are part of a global problem where we see rapid increases in ultra-processed food consumption across multiple countries, many contexts such as Canada and Australia, where a significant proportion of consumption is also from ultra-processed foods. This is actually one of the most rapidly growing sectors worldwide. Now, when we talk about ultra-processed foods, one of the common questions that we encounter is, so how do we evaluate ultra-processed foods? And so having a classification system that allows us to assess ultra-processed foods is quite important. And currently, one of the most widely used is the NOVA classification. The NOVA classification groups foods into 4 based on the level of processing. And ultra-processed foods are in the group 4 of this classification, and they're defined as formulations of ingredients and foods that really have undergone extensive industrial processing, hence the term ultra-processed. So these foods are hyperpalatable. They also have longer shelf life, and the ingredients tend to be really low cost, contributing to their low cost in our shops or supermarkets. So just to also give a broad overview of what we know so far about ultra-processed foods as they relate to health and nutrition outcomes. So this umbrella review by Melissa Lane and others really outlines the importance of ultra-processed foods as it relates to type 2 diabetes, for example, obesity, cardiovascular diseases, as well as mortality related to cardiovascular disease. As you can see, the evidence is increasing, but really showing really a clear association for us to be concerned about. In terms of how ultra-processed foods contribute to poor nutrition and health, we can think of 2 mechanisms. One is the nutrient mechanism, where we think that ultra-processed foods are associated with higher intake for nutrients such as calories through added sugars, high sodium, higher saturated fat and total fat, among others. In addition, ultra-processed foods tend to have lower fiber, protein, and other micronutrients. And they also replace healthy foods. In terms of the non-nutrient mechanisms, we know that the process of reformulation produces substances with little or no nutritional value. So, for example, the emulsifiers and artificial flavors, as well as neoformed contaminants, are, obviously related to health, and some of these products are endocrine disruptors, for example. However, there's a research gap in this space, and we see the need to continue to engage in understanding this a bit more clearly. Additionally, we have to think about how ultra-processed foods impact health, but also thinking about how food marketing interacts with food composition as well as metabolic. Metabolic processes such as gastric emptying, and how ultra-processed foods play a role in that and contribute to problems. Then finally, the role of ultra-processed foods in inflammation is something that we also should be aware of, where it's been associated with increased prevalence of these markers for inflammation. Finally, as we think about ultra-processed foods and how they are measured, just to come back to where we are in terms of progress in this field, we know that there are currently efforts globally to try and understand how ultra-processed foods are defined. The USDA recently had a call for comments to try and define, to provide input on the definition of ultra-processed foods, and the World Health Organization has also done the same. Now, for today's seminar, I would like to then hand over the discussion to two experts that are very knowledgeable on this topic. I'll first introduce the two speakers and then hand over to them for the next phase of this webinar. Our first speaker is Dr. Laura Schmidt, who is a professor of health policy in the School of Medicine and the University of California at San Francisco. She studies the interplay between the processed food industry and populations, and experiences that harm health harms from its products. Her research informs new ways to prevent obesity, diabetes, and related cardiometabolic diseases by making food systems more conducive to health. Our second speaker is Jessie Gouck. Jessie is a health program manager in the Nutrition and Physical Activity branch of the California Department of Public Health. Jessie's work informs the development and implementation of statewide and local policies, as well as programs that support healthy eating, nutrition security, physical activity, and healthy food systems. Welcome, Laura and Jessie, and thank you for joining us for this seminar series. Before I hand over to Laura and Jessie, for the audience members joining us today, please note that we'll have about 20 minutes at the end of the webinar where we can address comments. Please submit your questions for our panelists using the Q&A function at the bottom of the Zoom screen. And with that, I hand over to Laura.
Thanks, Isabel. I'm going to get my slides up and running. So it's great to be here again. I spoke about this topic a few months back in this seminar series, and I'll be interested very much to hear questions at the end and have a little conversation. So I'm going to just briefly talk a little bit about what we know about ultra-processed foods, and then speak to some of the challenges from the standpoint of defining these foods for regulatory purposes. So a lot of this got started because we saw this dramatic uptick in rates of obesity in America, and the introduction of ultra-processed foods at scale within the food system corresponds to this period. It was really researchers in Brazil who were watching the same transition happen in their country that started to try to get under the hood and understand a little bit more about what's in these foods, and that's where the NOVA classification comes from. One of the things we don't lack is evidence that ultra-processed foods, according to the NOVA classification, cause harm to health. This is an internationally accepted definition, the NOVA classification. There are countries all around the world that are using this, an adaptation of the NOVA classification to regulate foods, whether it's through warning labels or taxation and other strategies. If you go into PubMed, there are over 2,600 studies on the topic of ultra-processed foods. As this article demonstrates, there is an umbrella review of 45 meta-analyses. So that's 45 studies of studies demonstrating the connecting ultra-processed foods to obesity and all manner of cardiometabolic diseases, including premature death. These studies establish a clear dose response curve. So the more ultra processed foods people eat, the sicker they become, multiple health harms. And really, at this point, the field is not asking the question, do these products cause harm? The real question is how and why. And so there are multiple mechanisms that scientists are looking into, trying to understand what it is exactly about these foods that causes people to become sick. There are now 4 rigorous clinical trials establishing a causal relationship between ultra-processed foods and overeating and obesity or weight gain. This is the original trial in 2019 that Kevin Hall at NIH and colleagues conducted. Since then, there have been studies in Japan, the UK, as well as a second study in the US. These are very expensive and rigorous trials, but they are the gold standard when it comes to establishing causal inference. So we're not at a point of asking the question, do ultra-processed foods cause weight gain and obesity-related diseases? It's more about, at this point, how and why. Now, there's a lot of discussion about these 2 different concepts, ultra-processed foods on the one side and hyper-palatable foods on the other side. So if you look at the NOVA classification, the idea of ultra-processed foods, it's not about so much what's in the food, say sugar, fat, and salt. It's about what's been done to the food in terms of how processed it is, in terms of what additives have been put into the food, and so when we talk about ultra processed foods, we're more often talking about what's been done to the food. These are foods that can't be made at home; they have to be made in a factory. They are mechanically processed, and there's growing evidence that processing techniques such as extrusion, which is a very common processing technique, may liberate and make, say, proteins and carbohydrates more digestible, which could account for weight gain. They have cosmetic additives added. It's pretty hard to make these products without cosmetic additives because the goal is cheap and long shelf life. And you need preservatives and additives for that. In addition, when you mechanically process raw ingredients, it tends to bang them up quite a bit. They become less flavorful. And so the companies need to add in a lot of flavor and color additives to make the food more palatable. On the other side of things is this concept of hyperpalatability, which really goes to quite a big body of addiction and research in psychiatry and psychology showing that the limbic reward system in the brain gets triggered by these products. And there the definition revolves around unnaturally high combinations of sugar, fat, and salt. And so we have these 2 concepts kind of floating around. Nutrition scientists are often interested in the sugar, fat, and salt and what's in the food. But the idea of ultra-processed food is really around what's been done to the food. Now, what's important here is, as Tara Fazzino at University of Kansas and her colleagues have shown, most of what's out there in the market that we would call ultra-processed, made in a factory with chemical additives, is also hyperpalatable. It also has extremely high amounts of sugar, fat, and salt, amounts that you would never encounter in nature. You have to make it with to have these quantities of sugar, fat, and salt. So on a practical level, you go into the grocery store, most of what you're seeing that qualifies as ultra processed is also hyperpalatable, too much sugar, fat, and salt. Last time I was here, I spoke about the tobacco-owned food corporations. Tobacco companies in the US owned the largest food companies over a 45-year period throughout the 20th century, and many of our most popular brands today were owned and developed by tobacco companies. And I do think it's important to point out that when those tobacco companies got into the food market, they pushed the food supply towards greater hyperpalatability. So at the time that tobacco companies owned UPF brands, those brands were more likely to be hyperpalatable, up to 80% more likely to be hyperpalatable by some definitions. Now, what's interesting is that after this point, when the tobacco companies in 2008 had spun off all of their food subsidiaries, the rest of the food industry came up to the same level of hyperpalatability. So today's market, everything has has a high level of hyperpalatability or lots of sugar, fat, and salt in it. Now, I want to talk briefly to set Jessie up to speak from the California Health Department perspective about some of the challenges of taking this science and translating it for use in regulating these products and trying to protect health, especially children's health. One of the challenges is that by definition, ultra-processed food kind of cross-cuts multiple scientific silos, but also regulatory silos. So nutrition scientists are very interested in, again, what's in the food, and particularly the high levels of sugar, fat, and salt that often are in ultra-processed foods, as well as the relatively low amounts of fiber and micronutrients. So that's one field. Alongside of that, you have environmental toxicologists who are interested in the chemical additives that are coming into these foods. And that's a whole body of science with a very well-developed literature. Some of these chemicals are considered obesogens by themselves. Endocrine disruptors in very small doses can actually cause obesity. So the rates of obesity that we see today may partly be a result of the chemical additives being put into the ultra-processed foods. There are many other related concerns, carcinogenicity and reproductive toxins and so forth. Another field that touches on all of this is food science. These are the folks that focus on food processing and packaging technologies. And then finally, psychiatry, because we know that these hyperpalatable foods are disproportionately triggering hedonic drive in the brain and causing craving, food noise, addiction, and so forth. So one of the challenges when you step back and think, how might the state of California regulate these products, is that it really is going to cross-cut multiple divisions within the state government. At a minimum, folks in the health department worried about nutrition science, but also environmental toxicologists, and then in Cal EPA, and then you have our food services within schools and the many. So it's really a multi-sector approach that's needed to deal with this problem. Another big concern for regulating ultra-processed foods is the lack of transparency. It's very hard actually to know exactly what is in the food and therefore how to regulate it. So first of all, companies that make UPF are not required to tell anyone anything about the processing techniques. And so we really don't know when you open up a package what has been done to the food. Yet we know from research that the processing techniques do matter. They affect the texture, the frequency with which people chew. And this we know is something the companies, when they're making the food, actually measure because they want to increase that chew rate, make people eat more faster. Energy density, which is the amount of calories per bite, that matters quite a bit. Glycemic load. If there's a lot of free sugars and carbohydrates that are highly refined, that might really boost the blood sugar much more quickly, and transit time to the gut. So one of the big black boxes here from a regulatory strategy is exactly how are they processing a given food product. A second issue is ingredients. Now, we do have the ingredients label, but there are some things that aren't on it. For example, agents that are used during the processing of foods, oils and things that are put on in chemicals, put on equipment to grind and extrude. Those things may not be mentioned on the label. Preservatives, if there's chicken sitting in cold water, they may be putting chemicals in there to prohibit bacterial growth. Things like that may not be listed on the label. In addition, the chemical colors, flavors tend to be grouped as natural or artificial flavors. You'll see on the package, it'll just say artificial flavors without telling you what are the chemicals that have been put in the food. And in fact, the current definition of natural versus artificial is very vague and easy for manufacturers to game the label and claim that things are natural when really, if you knew the exact chemical additives, you might consider that wouldn't necessarily consider that natural. And then finally, there's a lot of ambiguity about the safety of the chemical additives, and this derives from an FDA policy called generally recognized as safe, or GRAS. And essentially, the companies are in the position to decide what they think is generally recognized as safe. They don't need to present that information and prove to the FDA that the chemicals they're adding to food are safe. They essentially are waiting to get sued. And of course, it's very hard to identify one chemical in food and say that caused a given disease. So it's a tricky area. And as a result, we really don't know how many chemicals and exactly what chemicals are being put into the food supply. I've seen very wide-ranging estimates, but we think it's a lot. We think that because companies since 1997 have been allowed to just sort of decide for themselves, that has actually increased the number of chemical additives in the food supply. But this is an area that is very challenging to regulate because we really don't know. And then finally, there's a growing body of evidence in environmental toxicology that the chemicals in the packaging of food migrate into the food. And that might even be the colors and designs and advertising on the packaging, as well as microplastics that are migrating into the food. And along in those microplastics may be chemicals such as PFAS. And I'm referencing here one of many systematic reviews on the topic, but there's growing concern that the chemical additives in the packaging are part of the chemical load that people are absorbing when they eat a diet in ultra-processed foods. Finally, another challenge from a regulatory standpoint has to do with industry interference in the science and policy related to ultra-processed foods. This is a wonderful paper by a scientist in France. This was in 2018. And they studied critiques in the scientific literature, critiques of the NOVA classification. There's a narrative that seems to be promulgated by the industry-funded scientists that NOVA is so broad that it doesn't really mean anything. And therefore, UPF as a classification is meaningless. This scientific paper demonstrated that of the 38 critiques out there in the literature, 33 was made by scientists who had been funded by the food industry. We also know that there's been efforts to directly undermine the NOVA classification. Novo Nordisk Foundation, they make Ozempic, but they're also integrating into the food business. And they've put a lot of money into a team of scientists in Denmark who were supposed to come up with a NOVA 2.0, something new and better that might just, that would hopefully, from their standpoint, be an industry-friendly definition of ultra-processed foods. And then finally, we've seen this new front group emerged just in the last couple of weeks, Americans for Ingredient Transparency. This is a group of lobbyists who've been funded by food industry actors, Coca-Cola, Nestle, Kraft Heinz, The front group is pushing for federal preemption. So what this would mean is a federal law that defines ultra-processed foods according to maybe in ways that the industry would prefer, that would override laws like the one just passed in California to remove ultra-processed foods from California schools, otherwise known as AB 1264. So this is a classic. We've seen this over and over again with the industry. Sometimes we call a group like this, we have all manner of names for this, but one is AstroTurf, like a fake grassroots movement that is really funded by well-endowed industry actors and lobbyists to argue that we need a change in law. So just to finish up here, there isn't a lot of concern in the scientific community. There's quite a bit of consensus around the idea that UPF exist, that they cause obesity, they cause cardiometabolic disease. That is well established. The evidence is robust, and anyone who believes, who looks at the literature objectively will see that cumulatively we meet the Bradford Hill criteria for causation with several very rigorous clinical trials. So that's not at issue. And the international community, the World Health Organization and the Pan American Health Organization have adopted this as a regulatory strategy. So the real questions come down to how do we translate this science into policy? And there I mentioned a number of challenges. One is that there's the definition of UPF by its very nature is cross-cutting different regulatory silos. So you really need multiple actors at a state or federal level working together across environmental contaminants and nutrition science and food science to unpack a regulatory definition. There's also a lack of transparency about processing techniques and exactly what additives are in the food, what chemicals have been added. And then finally, there's direct interference by the ultra-processed food industry in efforts in both the science and also in policy making. And so these are some challenges, and I'm very happy to turn this over to Jessie, who can share with us a little bit about how the state of California has done a really remarkable job at overcoming some of these challenges to develop a regulatory definition of UPF. Take it away, Jessie.
Thank you, Laura. Just pull up my slides here. I just want to confirm that you can see the title slide. Okay, great. Well, hello, everyone. Good afternoon. My name is Jessie Gouck. I am a health program specialist program manager, excuse me, in the Nutrition and Physical Activity branch at the California Department of Public Health, and honored to be with all of you today to talk about this. I really appreciate hearing from both Isabel and Laura about the discussion of the evidence in terms of what we know well, and also where we still have questions and where we're looking to explore. I'm really going to be talking to you today from the perspective of an implementer and a practitioner. California Department of Public Health is interested in both advancing and supporting health, both in terms of thinking about food safety, but also prevention and creating food systems and food environments where people can thrive for lifelong health. So we're going to talk a little bit about our role in some of this discussion and new policy around ultra-processed foods. So I want to start talking a little bit about California's current precautionary approach. to thinking about food. Really, California has been, for a long time, a leader in the food space. We have made significant investments in nutrition and accessing locally or across California grown and raised products in various settings, including schools. And today I'm really going to focus on some recent work that has shown a light on ultra processed foods in the process of this. So I just wanted to highlight a couple of things that have happened in terms of legislation ultimately being enacted into law here in California. A couple years ago, we saw the California Food Safety Act, which bans the sale of food products throughout the entire state containing four specific chemicals. So this includes brominated vegetable oil, potassium bromate, as well as propylparaben and red dye number 3. So this goes into effect in the state of California um, January 1st, 2027. On the heels of that legislation, we saw the California School Food Safety Act, which will include in school foods all of the ingredients that I just mentioned, but that bans the sale of food products across California in schools. Um, it prohibits very specific use of harmful synthetic food dyes in school meals. This will also go into effect at the end of 2027. Then we had an executive order from Governor Newsom in January of this year that directed various state departments, but California Department of Public Health specifically, to look at how we can reduce harms associated with eating these ultra processed foods and vegetables. So we saw some real momentum and interest in thinking about ways that we can start to reduce consumption of those foods. And then, just as Laura just mentioned, just this past October, we saw Assembly Bill 1264, which is also known as the Real Food Healthy Kids Act, be signed into law by the governor, championed by Assemblymember Gabriel, as were all three of these bills. And this we're going to spend the majority of our time on today. So when we look at that bill, we focus on 1264, which is how I'll refer to it for the rest of our time together. What we know from the language in the bill is that the intention was to reduce consumption of ultra processed foods by the children of California and to encourage schools and school districts to promote and provide healthier options in schools. California is a leader in providing healthy school meals already, but just like we know, even in our own lives, there might always be something we can do to kind of increase the healthfulness of our food choices. Another intention of the bill is to prioritize the inclusion of California grown agriculture as well as whole food products in school meals. So really want to get us thinking about, as we're talking about this, we are looking at reducing consumption of ultra processed foods, but we are also looking at ways that we might increase consumption of these known more healthful options, the whole and minimally processed foods. So Laura spent some time talking about this already, and I don't want to repeat exactly what she said. But really, when we are talking about reducing ultra processed food consumption, we do have to define it. And she has already spent quite a bit of time talking about why that's challenging. I think what's also interesting is when Isabel started us out, she was really talking about the proportion of ultra processed foods that are eaten or consumed. And then Laura was talking about the proportion of them that are really known to be hyper palatable, or these things that we kind of can't stop eating. And then, here on the slide, I have something that's talking about the proportion of the food supply. So, like, what do you find on shelves? What's being served to us? So, the reality is that when we're talking about changing our behavior or changing our food systems or our environments around us, we have to think about ultra processed foods in many different ways. We have to think about them as they're created, manufactured, produced, distributed, how we eat them. All these different things come into play, and it's complicated. I think there's a lot of folks on this call who are involved in food in some way, shape, or form on a day-to-day basis. And I think we know it's not simple. We want it to be, but it really isn't. Food is complicated. The way it is grown, the way that it is manufactured, the way it's distributed, the way we cook it and serve it is not is not simple when we think about all the systems that come into play. And so when we talk about defining ultra processed foods for the purpose of making some of these changes, we really need to have a definition that works for whatever the challenge is that we are hoping to get after. And so, and I think I saw a question come in the chat already about this. What about potentially the discrepancy in definitions for ultra processed foods? Sometimes you have to think about a definition for something that is not necessarily going to be as broad as everything under the sun that it might encompass, but coming up with a definition that allows you to address a very specific issue or concern. In this case, we're going to talk about how do we create the most healthful food environment for our students when they're receiving or consuming foods during their school day. So again, Laura talked about this at length. You know, we do really have to think about the qualities of ultra processed foods when we think about how we're going to define them. And she already did a fantastic job of talking about why there are so many things that we think of when we think of ultra processed foods that make it challenging to use that as a part of the definition because so much of that information is unknown to us. And really, one of the things that I want to kind of add to that conversation is that from an implementation standpoint and a practitioner standpoint, we need to be able to think about how we have foods available in these different environments that does not require a huge cohort of researchers or academics or food scientists always to look at every single food product. We need to be able to define something so we can quickly understand and discern if something qualifies for whatever the category is or not. And so we can also think about this in terms of what we really know and understanding the evidence around some of the markers of ultra processed foods and whether or not we know they have potential for negative health outcomes. And so we can use bits and pieces of these markers to help us understand and define something with the information that we have at our fingertips and still feel confident that we are addressing a good portion of the ultra processed foods that are out and available for purchase. So here's where I'll spend probably the bulk of my time, which is really around what did AB 1264 do? And so I know there's a lot of text on the slide, and I'll try to move through it relatively quickly, but happy to take questions as they come. This question of how do we create a definition? What California did, and this was an act of the legislature, California will be, CDPH will be one of the implementers of this, was created an and definition. So what that does is it takes some of the markers that we just talked about, and we said, for this exact purpose of thinking about foods that we are going to think about for regulatory process or potentially for intervention in California, which just means for folks who don't speak all the public health language, just means maybe something we might do something about. When I say intervention here, we're saying we're going to really care about these things first. It doesn't mean that we don't have an interest in still understanding, exploring other areas, but given that we know that the current landscape of foods is somewhere in the range of 70% that could qualify as ultra processed foods, we can't just take 70% of foods away in schools. So we really need to think about how we can have the greatest impact that promotes the healthful foods that we're talking about and create a definition that helps us really think of the foods that might be the most concerning to start. So this and definition requires these qualifiers here. For a food to qualify as ultra processed in California now, it must contain one or more of a certain subset of cosmetic additives, and it must be either high in saturated, added saturated fat, salt, or added sugar, or contain a non-nutritive sweetener, which is a generally also another term for that is a sugar alternative, non-sugar alternative. There are exceptions. Encourage people to check out the legislation to see exactly what those exemptions are. The bill also requires the California Department of Public Health, as well as a lot of partners across sectors, which Laura alluded to. Those partners include the Department of Education, the Department of Food and Agriculture, school food professionals, nutrition directors in schools, to follow a regulatory process, which is a process that's defined by California law called the Administrative Procedures Act, to create two subsets of definitions of ultra-processed food. The first one is called ultra-processed foods of concern, and the second is called restricted school foods. There will be a public process that allows for folks, stakeholders, those that are interested in engaging in determining what those definitions will be. That process will play out over the next couple years. And those will ultimately become a second set of legal definitions that we will ultimately use, moving to the third column, to actually change school food environments. I think I saw a few questions about this already pop up in the Q&A, but ultimately, once those definitions exist, we will provide training and technical assistance both to the food vendors, so those who distribute foods and sell foods to schools, as well as school food professionals, on how to understand what foods qualify and what do not. We'll also have a reporting system for school food vendors so we can track and understand what foods are being made available to schools and how the school food purchasing and environment is changing over time. What that will look like, and we'll talk a little bit about a timeline in just a moment, is that these ultra processed foods of concern and restricted school foods are intended to start being phased out of schools starting in 2029 with full compliance in California in 2035. And those reports and that progress that I talked about, those are annual reports that will come out once this starts to happen that will be publicly available. So what's next? So this bill, like I mentioned, was just signed in early October, and so it goes into effect January 1 of 2026. I mentioned the regulatory process, so we will work with many others to define ultra-processed foods of concern. We will continue to review the existing evidence and criteria that exists in the bill and what we know to help us create those definitions. We'll bring in scientific experts from across the spectrum, academia, environmental health and hazard, and I already mentioned our education and food and ag partners as well. Again, there will be an opportunity for public comment on that. And I mentioned that once they are defined, we really will move into supporting those who actually serve school food environment and in schools serving food, as well as begin data collection and really try to understand the impact of this bill over time. So we get a lot of questions on the timeline. People say, wait, it's 2025, 2035 seems like a long time away, but we're doing this for the first time in California. Really, there is no other legal definition for ultra-processed food in the United States until now, and we really need and want to get this next phase right. And so the regulatory process will take some time to play out to be able to engage all of those interested and very, very important partners and folks who have expertise across the spectrum. And some of these things are time bound, right? We can't, until we go through the process of understanding what would be those subset definitions, we can't actually start rolling that out to the food industry for not only food industry to potentially make some changes to what they're selling, but also for distributors in terms of what they make available to schools, whether or not those foods are ultra processed, and certainly for schools to think about their procurement practices and what they bring in. And so really this timeline that you have on the screen, it's successive different steps that will lead towards ultimately, again, that beginning of the rollout of the changes in schools starting in 2029 with that final compliance in 2035. So I'll end on this slide, which is, a just true acknowledgement of how hard school food professionals are already working to really balance the nutritional needs of students and the very real budget constraints that they have in order to procure food and then serve it. And we have school districts and schools that vary so widely across the state, everybody doing a very, very good job to serve either hundreds or thousands or hundreds of thousands of students, and it really looks different. And so we are very mindful of what this could look like for implementation for those of you who really are on the ground doing this work. And I said this at the beginning, it really is equally as important to think about ensuring access to good quality, affordable, healthy food as it is to think about what we're doing to remove some of these unhealthy foods from school environments and even environments outside of schools. And so I mentioned that cross-sector work that is essential to thinking about pathways for school food procurement and thinking about ways in which not just the food industry responds, but how do growers respond? What are we doing on the sort of food hub, farm to school side of things that changes procurement other than just reformulation of different products? And really continuing those conversations around other supportive opportunities like school food kitchen investments, like California grown products, those are vital. And so thinking about this not just as this one chance to remove certain types, but holistically across food environments, and then, in this specific case, school food environments. And with that, I will end and turn it back over for Q&A.
Great. Thank you so much, Laura and Jessie. So now we'll begin the Q&A portion of the webinar. And in the interest of time, I'm going to hand this over to Nia Sangera, who's the BFI Policy Director, to guide us through the Q&A session. Thanks.
Thank you, Isabel, and thanks for everyone who's joining us. We have over 40 incredible questions in the chat. Keep them coming, but we're unfortunately not going to be able to answer all of them. The first question I'm going to ask is on the topic of funding. I invite any of our panelists today to weigh in, but it's really about is there going to be additional funding, resources, support for California schools, nutrition services in the years to come to support programs like Harvest of the Month, for example? How can we continue to get funding to move away from processed foods in school lunches? Are there any supporting initiatives to the bill to help schools source from whole foods, improve kitchen equipment, train staff? Is there a fiscal note associated with this legislation? I'm just kind of gathering a bunch of the questions that are coming in on the topic of funding here.
I'm happy to take a stab at that one. So as this bill was written, there is no requirement for funding as it was authored and signed, and the budget process in the state is a separate process. So we will have to keep an eye out and look and see ultimately how sort of budget is appropriated with state funds. That is done annually. Certainly, we'll also be interested in any other public sources, so any that might come from the federal level, certainly at the state level, anything that might come up locally that we can see as a model, and then certainly investments that come from other places. We have certainly seen California investments. I think if there's food professionals on the call, there's been some great investments over the last couple of years in farm to school food hubs and aggregating sort of food distribution and ways to connect there. I think also there had been for some time some kitchen infrastructure funding also that had been available. What that looks like in the future remains to be seen. As always, I encourage when we work with our local partners, we encourage them to work locally with decision makers and continue to communicate the evidence and impact of these types of interventions to, continue to seek funding to advance this work on a whole.
Wonderful. Thanks, Jesse. Here's maybe a quick one if you know off the top of your head. Do you know what percentage of foods currently served in California school meals are considered ultra-processed foods?
Well, we know that about 62% of what kids eat is ultra processed, and we know that 72% of the food in the grocery store is ultra processed. So it's probably, but I don't know of a specific number for the schools.
We don't currently have a data source for exactly what foods are sold um, to schools and exactly how we don't have an aggregated data set at the state level ultimately for how it is served as well. So that's something that we're hoping AB 1264 implementation can actually inform. One of the requirements of the bill is for anybody who sells food to schools to report into a database that tells us exactly what foods are being made available to schools and what's being purchased. So we really should, in the next couple of years, have a much better understanding from that perspective of what foods are going into California schools.
Great, thank you. Here is maybe a question for Laura and Isabel. Where is most of the money for research on ultra-processed foods coming from? And do you know by how much we would need to increase the availability of funding for this type of research? And do you have any perspectives on the role of philanthropy for supporting research on ultra-processed foods?
Yeah, it's fundamental because currently there isn't really an institution, a National Institute on Nutrition Science. The funding is sort of at the federal level, sort of spread around, and the funding is mainly driven by sort of disease endpoints. Like diabetes or heart disease or addiction, rather than thinking about risk factors like ultra processed foods. So, at any given institute, UPF may be a topic of concern, but the funding is woefully inadequate. A lot of our research in nutrition science is funded by the food industry, and we have numerous meta-analyses to show that if authors on scientific papers have received funding from the food industry, the conclusions of their research are more likely to be food industry friendly. And so there is objective evidence that conflicts of interest really matter for research outcomes. This leaves the role of philanthropy. It's an essential role, and I'll leave it at that.
Laura, maybe just kind of on the topic of food industry as well, do you know what kind of guardrails that can be put in place to avoid the food industry dominating the public comment period, for example, on the operational definition of ultra-processed foods?
Building citizens getting involved in submitting comments is the answer to that. We live in a democracy, and the food industry is can submit as many comments as it wants, and that so it really comes down to scientists, researchers, students, citizens speaking up about how we feel about what's in the food supply and how it should be regulated. I myself have submitted a comment along with other UC faculty urging the federal government to create a regulatory definition of UPF that it can use to stem the crisis of cardiometabolic disease in this country. We've got children with diseases that children shouldn't have: diabetes, fatty liver disease, cancers, and a lot of this is nutrition related. and we need to move quickly to fix this problem.
I think
Thanks,
just to
Laura.
chime in briefly, Neha, just to also add that I think really piggybacking on the science is really critical that we look at evidence to guide the processes. Those are my 2 cents on that. Yeah.
Wonderful. The next question is related to AB 1264. Do we know why USDA foods are exempt from this piece of legislation? USDA foods, well, I guess the commenter is saying USDA foods should not be exempt. But I'm seeing in the comments or questions a few notes about how schools have to work with the kind of commodities list that's made available to them. Any comments from our panelists on how that will function with the new legislation in place?
Yeah, I think I can't speak to exactly like how the legislation was designed. If anyone has any questions about that, I encourage them to reach out to the authors or the sponsor's office. But I will sort of comment on the secondary comments, which is there are some requirements for schools that serve foods out of some of the federal programs to receive some foods out of those programs. And we uh, could not see those foods taken away in California, or California schools would not be able to participate in those programs.
Wonderful. Thank you, Jessie. Here's maybe a quick one. Is there an effort to label ultra-processed foods in a way that is similar to labels that were placed on cigarettes?
Yes, and this is an important part of the open comment period around a federal definition of UPF. And if we have one, the USDA would be potentially could be included in that definition, solving this issue of US schools reliant on USDA foods. But yes, there is an active discussion right now around a front of package warning label. The challenge is that the food industry is trying to interfere with that process and get the kind of label that they would prefer on it. We've seen this issue over and over again. It's happened in Europe and many countries. When countries move to regulate UPF, the industry tries to get an industry-friendly label on the front. And so what we really need is an objective, independent, science-based definition that drives the label. And this is, again, underscores the critical importance of not just having a state of California moving towards regulating UPF, but having the federal government do so as well.
Great. Thank you all. This has been a fantastic webinar. Thank you everyone for joining and for your questions. We didn't get to every question, but we've made note of all the different questions. And feel free to reach out to us if you've got any follow-up questions. But thanking the panelists and everyone that made time to join this webinar. With that, I would like to close this webinar and encourage you to go to the BFI website to see future exciting events. Thanks, everyone. Bye.